Hey everyone, it's Catie Harris, CEO and founder of NursePreneurs, and in just a minute we're going to be bringing on Catherine Berger, who is a nurse who started a program called the Nurse Leader Mastermind, and just kind of talk to her about how she started, kind of her background in nursing, and some of the things that she has struggled with, because I think it's an important aspect when you are starting something like this to understand that it's not always a simple, easy road, right? So I think having some real stories of what people are doing and um, what they are struggling with will help you to move forward. Coming up next is Catherine Berger, and stay tuned because afterwards we'll just talk about how that conversation went. All right, Catherine Berger is here with me today, and Catherine, I just wanted to ask you, like, what kind of nurse are you, and how did it lead to you coming to start a business?
All right. Well, in my 30 years of, nearly 30 years of being an RN, I have had a variety. I kind of call it my ADD career path, where every few years it seems like another great opportunity came along. And so I've had the privilege of, I started off in L&D just out of nursing school, and I hated it. I was an ICU nurse at heart, give me chest pain over labor pain any day still. And so I was able to kind of move through some of those inpatient arenas, and then ended up in home health for a little while, loved that. Then we moved, and I still had my associate's degree. And so at the time where we moved to, the organization would only hire BSN nurses to be, or public health nurse certified to be in home health. So I ended up in a call center, and then a triage call center, went into ambulatory care, and the leadership positions just kind of kept coming up for me. I'm one of those people that constantly ask, okay, well, what if we did this? And I always tell people that if you're constantly asking that, then you probably need to just be in leadership rather than fighting it. You're fighting it. And many of my roles were in leadership positions, and ended up in the outpatient arena, ended up managing an ICU, did informatics and clinical education for a little while. And then my last formal role in executive nursing, I was the assistant director for nursing clinical practice. And that was a really interesting role of influence, right? Where I had the responsibility of the whole medical center and all the outbuildings, but no direct way to make things happen, just encouraging people. Eventually in my education, I had got my bachelor's degree, and then my master's, I wanted it something different, something kind of for me. So I ended up with a master's in organizational leadership and strategic change management. And so that's been really fun and interesting to look at how we do healthcare as a business and an organization from the other side. When we moved to Southern California, I decided at that time to retire from nursing, executive nursing. And I had a home business, skincare business on the side that was doing really well. And so I thought, well, my husband and I talked, let's try this venture. And of course, going from 1,000 miles an hour down to 30, being that work from home mom. In fact, I laugh because we have 5 kids, but only one is still at home. And the first day that I was technically that stay-at-home mom, I forgot to pick my son up from school. Some of us are just not cut out for it, but it's just, it's a bigger job than you think. So anyway, so working from home, I stumbled into doing freelance writing. I mostly write for registerednursing.org. It's I ghostwrite for them. And then they will do all my pitches. It's a great gig because they pitch out to different, minority nurse and Medscape. And so I've had the privilege of writing for a lot of those venues. And along that journey came along with, I've continued to stay in the mentoring and coaching realm for nurse leaders. That's a passion of mine. And so I would reach out when I would see nurse leaders struggling on different Facebook groups like Show Me Your Stethoscope or some of those. And they're just like, I can't do this anymore. This is just awful. And I would reach out to them and say, oh my gosh, sister, what can we do? Let's talk. Just because we as a profession, we need quality, caring, compassionate nurse leaders. And it is not an easy role. Leading from the middle is not easy. And so we need a tribe of people that we trust and that we can surround ourselves with. And coming from a large organization, we had a lot of peer groups, but typically you only have a peer group if you're at the director level or above. If you're the assistant manager or the manager, especially on the hospital side, there is no time for any kind of support networking, anything like that. And I found myself talking to nurse leaders who really had no idea what they were doing, and they had no guidance at all. In a large organization, you might have people that you can talk to, but if you're the nurse manager in a rural Indian health clinic, you have nobody. And so the idea came to me. I'd taken a course on how to build a mastermind, and I really felt like, okay, this is it. This is what I'm meant to do. It's my passion, and it's also a business venture, being entrepreneurial. And so I created the Nurse Leader Mastermind. The idea is that nurse leaders, so managers, probably most likely, can come together on a virtual format like Zoom and connect. And then as a facilitator, I'm guiding them. And then they're able to identify some of their problems. And then as a group, we jump in and we solve those problems. And then continued after the formal session is a connection over LinkedIn, where they have a private LinkedIn group and they're able to continue to network with one another. And so in a sense, it's like a lifetime of mentoring and coaching. And so that's how it has evolved, and that's where I am today. I realized quickly that I needed to get my continuing education provider license, because as nurses, we have a challenge paying for personal development unless we're getting CEs for it, right? It's just part of our culture. And so able to offer the CEs, able to then also look around and see who else can I partner with as a CE provider, and help them in their business and offer the CEs. So that's been a really interesting journey as well. But trying to combine my passion of helping and mentoring with a business venture. And so that's where I am.
Yeah, no, that's awesome. And what I love, because what you said there is that you kind of found a problem. So you have this expertise and you can do a gazillion things. Like all nurses have like a million certifications and education and experience, and we all have this stuff. And one of the things that I see nurses doing is trying to combine all of that into one thing. And I love that you found like a specific problem looking at the nurse leaders from your expertise and from your role of the different positions that you've had, and you just see this problem, and it's a very specific audience,
Yes.
and you're looking for ways to solve that problem, right? So
Yes.
the first idea you have might not be the business, right? But it's an idea that gets you started. And I don't know that this is your path or not, but just for anybody that's watching, your first idea might not be the right business model, but it's a start, and you got to start. You got to get out there and see what works and what your audience actually wants, because
Right.
there's a lot of people that want to start a course and just say, I'm going to have a course for leadership, and then start looking for an audience to come to that course. And it doesn't make sense to do it that way. It's find the audience first and say, what do you want? What do you need? And then you deliver that to them.
Yes.
So
And
yeah,
just because you build it doesn't mean they'll come.
right. That's how I know that from
Wrong.
experience.
The movie was wrong.
Yeah. I spent a lot of money and energy on a course that, nobody really wanted. So, and then you had to go back to the drawing board and start all over again. And it's just,
But what I find interesting is that when I speak with nursing leaders one-on-one, they want it. They agree that this is exactly what they need. My beta test, I did a beta test, and I had 6 nursing leaders, anywhere from an assistant manager up to an A&M, or I'm sorry, an assistant manager up to a CEO, and the beta test went fabulous. They loved it, loved it, loved it. And then at the end, it never occurred to me that my masterminds wouldn't just fill every month. I was going to have waiting lists. I just knew it, right? And so I build it. I literally built my own website, all that stuff, because of, trying to keep things tight in budget. And it has been crickets. So, I've done some Facebook advertising, I've done some Instagram advertising, some LinkedIn advertising. Um, the word of mouth, I have great connections, and they are sharing it. But for some reason, and when I look at my statistics, my analytics, people go and they look at the course and then, or the mastermind, and then they don't purchase.
yeah.
So it's been interesting, and I think it has to do with some of our culture in leadership, that we expect our staff to stay current on their practice model, right? And to get their certifications and all this stuff. We expect that of our staff, but for nurse leaders, we don't always invest in personal development. And so maybe, like you said, this is a great idea. It's a great model. People say they want it, but maybe they're just not ready for it. So I have to be willing to continue to tweak and bob and weave as a business owner.
Yeah, and I really appreciate you saying that because, I think that there's this whole myth out there of like, build a course and they'll come and you'll make $1 million next week or something like that. And it just, there's a big, big learning curve from the
Yes,
free model to the paid model. And it's huge, and
right.
it's a long road. So thank you for saying that because, I've honestly have had the same issue, and there's definitely things that you can do and need to do, and that's part of a marketing plan and also an education plan. And sometimes, like you said, when they're not ready, you have to go back and do this whole other piece before you can move them to where they need to be. So, all right, Catherine. Well, what is the name of your course so people can go check it out and find out more?
It is nurseleadermastermind.org.
All right. Well, thank you very much.
Thank you.
All right, guys, we are finished talking to Catherine Berger, and I think she dropped some really great points there. So here you have a nurse who is very, very well educated. She has a lot going on. She has a lot of expertise, a lot of knowledge, and she's able to share that. So one of the things that she did not get caught up in was, oh my gosh, how do I use all of my expertise in one business? So, at some point you just have to find a problem, and a lot of times that comes with an audience. So starting with the audience, who is the audience and what is the problem? And that's what she found. And she was lucky that she had a problem and didn't start with a solution and say, oh, well, I'm going to create a course. She started with a problem and an audience. Now, one of the things that I talked to Catherine about after our our interview was what she could do or should do next. And one of those things is to find some way to appeal to nurse managers. So identifying them and saying, hey, this is the group that I want to help become leaders, and then harnessing them in a way, like whether you round them up in a Facebook group or a LinkedIn group, or if you have a podcast or YouTube channel, if you really like writing, you could do a blog. But you have to find a way to get in front of your audience and to really just connect with them and continue listening to them, because one of the issues And Catherine had said that one of her biggest problems was that while she had a lot of enthusiasm for the free program, she got crickets when she tried to sell it. And one of the things that you'll notice is if you go to her website, it's an offer, and there's no in-between stage. There's no stage to get to know Catherine, and Catherine is amazing, right? So you listen to her and you're like, oh wow, she's amazing. But when you go to her website, you don't get that same amazingness. You get it from talking to her. So for her, I recommend that she continue doing podcasts, that she start her own podcast, or just find a way to get in front of her audience and just show them how awesome she is. And that will, sorry, that will be the key factor for her and for her success. So I hope you appreciate it. That Catherine came on here and was just able to tell you where she is in her business and some of the struggles that she's having, because we all have them, I promise you. So I hope that this will inspire you to start your business, or at least start going down that path. And if you're not sure where to get started or how to get started, you can always go to my website, catieharris.com/free course, and you can take our Profitable Idea Blueprint for free to help you clarify what problem you're solving. And till next time, stay inspired. Make sure you subscribe and like this video so that I know to make more, and I'll talk to you in the next one.